Hello, my name is Sophia Manzi, and I'm going to be doing a presentation today on sepsis and why sepsis is such an important issue. I have two other nurses here with me. This is Nikema and Christina. Um, so I'm going to get started. First topic is what is sepsis and why is it an issue? Sepsis is an infection at any body site that travels throughout the patient's bloodstream. Sepsis has caused over 34,000 deaths in the year 2007 and remains to be a leading cause of death. Sepsis costs the U.S. over $400 billion annually, and research has shown that the higher the compliance rate was with sepsis protocols, the rate of mortality would decrease also. Why is sepsis so important to know about? Sepsis is important because if not treated early, it can be life threatening. It's very important that caretakers are aware of signs and symptoms of sepsis to intervene early. Sepsis occurs when the immune system goes into overdrive from an infection and the body can become overwhelmed. Bodily organs, including the kidneys, may stop functioning and go into shutdown, and eventually death may occur if not treated early. A change in sepsis awareness would improve the mortality and morbidity rate for all septic patients. Why are sepsis protocols even needed? Research has shown that in institutions where volume is higher, particularly in overcrowded institutions, there were delays in fluid loading and first antibiotic administration to patients who appeared to be septic. This has still been a difficult issue to resolve, but because of that issue, the Surviving Sepsis campaign has initiated protocols that should be followed, usually within 1 hour of the patient being admitted or being introduced into the emergency room. Early recognition of sepsis by the triage nurse was also shown to have challenges because the clinical presentations can present differently and may confuse providers. Proof that a change in sepsis awareness is needed. According to McNabb research, sepsis claimed the lives of at least 6 million people annually worldwide. Research has shown that with early recognition and treatment, these deaths may be preventable. Experts think that increased awareness and detection, rapid administration of fluids and treatments, the amount of sepsis related deaths would decrease by implementing sepsis protocols. Continuation of why sepsis is needed. Sepsis initiation and treatment is usually begun in the emergency room. Thus, thorough triage and evaluation, including correct vital signs, is important. Most diagnostic indicators that are looked for are respiration rates that are greater than 20, a body temperature that's greater than 38 degrees Celsius, a heart rate higher than 90, or an increase in white blood cell counts greater than 12,000. Improvement Project Clinical. Step one, problem identification and baseline data. My aims were to develop a sepsis champion team and reduce sepsis mortality and morbidity in the ER. I expect that by working on this problem, we will triage more patients appropriately. It is important for us to work on this because doing so will decrease mortality and morbidity related to sepsis. It is equally important to educate the general public about sepsis awareness.
You guys do different specific lab testing in your ER?
Yes, we do. We'll do blood cultures on everyone. You do a lactic count along with just regular blood panels. All right. Let's see if I can make this bigger. Okay, so our project goal will be sepsis management. Team members will be physicians, respiratory team, nurses, phlebotomy, X-ray, CT, the imaging staff. Um, And data to support this has shown that observations have been made that patients that arrive to the emergency room, they have had a delay in care that's been given due to overwhelming high volume of the emergency room, and patients do suffer an increase in mortality or morbidity related to that. Um, some barriers that were noted were understaffing, nurses being burnt out, some nurses uneducated on the process of sepsis and their protocols, job dissatisfaction, and levels of education for caregivers.
Overload with the nurses, you can't get to the computer in
Mm-hmm.
enough time to be able to learn those systems and to be able to input the vital signs and everything in order
Mm-hmm.
for it to trigger.
Yeah, that's true. All right, and the data collection process that I use, we did chart audits from the nursing education department for 6 months, and we looked at all patients that had diagnosis of sepsis and what patients were treated with the sepsis protocol compared to which ones were not treated with the sepsis protocol, and the and evidence of an increase in mortality or morbidity. All right, let's see. Let's see this.
My facility just started that as well.
They did.
Mm-hmm.
Really? Yeah, I have
so
like the team there for
Yeah,
it.
and then like on our screen, whenever we log onto the computer, it has if the patient triggers anything, every time you log on. You
Okay.
have to acknowledge it.
Okay. Do y'all have to get the
It
physicians
is.
too?
Yes.
You get the
Mhm.
physician,
We
okay,
do.
and then they call the code sepsis for you.
And we have what they call a react. So we have an hour to go into the provider tab or
Okay.
tabs and to look at it and see if it's vital signs or what is it that causes a high react or a very high react.
Yeah.
And then you have to take action.
Okay.
Yeah.
Oh, that's good to know.
And then if not, it'll flag to the charge nurse.
Yeah.
So yeah.
So she would get it too.
Yeah.
Oh, that's really cool. That's my first time hearing about that one.
Yeah.
So that's good to know. All right, let's see. All right, so I can swallow that one. So in 2008, they were speaking about how prevalent sepsis was, and they did show an increase from 11.6% to 24%, um, just over the last few years. So it still is a issue at hand, and it's increasing. So we do want to work to try to change that.
And could it be that we're more aware of sepsis as opposed to not knowing so much at first what it was exactly?
I think so too.
Yeah.
I think so. But I know a lot. I know a lot of issues we've had in the emergency room. It's just so overcrowded. It's like it's way too many people.
Yes.
And then the sepsis alert, like it fires like on a lot of people. It could be like
exactly.
I don't know, respirations, but maybe a little high.
And they're high on an asthma patient, or the pulse rate is up. Somebody just got a breathing treatment, or so yeah.
It's a lot of things that can make it flag.
Somebody has to kind of be. It has to be somebody that can be designated to not be on the floor with the patients that can actually monitor the paperwork.
Right.
Yeah.
Well, I know at Grady they just hired some people specific to that.
Yes, we have some too, and that's what kind of helps us. And they'll come to us and tell us. Sometimes you think they're being, annoying, but they're able to see something that you might not see until later in the shift because you don't have time to chart right
Yeah, it's very helpful.
It's very helpful.
Yep, that was a good point, Sarah. Okay, so link current evidence and benchmarking best practices. So evidence from the literature has shown that early goal-directed therapy has been often underutilized in the emergency rooms because that's where most people start their care in the emergency room, and then they would go on to the units or to ICU, whichever one was appropriate. So to combat this, a non-invasive measure has been implemented. They want all patients to be treated for sepsis within 1 hour. It's very important, and it has shown to present with a more favorable patient outcome. Let's see.
and it would probably definitely decrease the mortality rates.
Mm-hmm.
They might get sick, but they don't have to die.
Right. Somebody acted early on.
Exactly.
So the Institute for Healthcare Improvement model used the Plan, Do, Study, Act, which engages physicians and staff in the improvement and execution, improving capacity and quality of care. The severe sepsis bundle included the 3-hour resuscitation and the 6-hour septic shock bundles. The 3-hour bundle includes measuring lactate levels, obtaining blood cultures, and administering broad spectrum antibiotics, and infusing crystalloids for hypotensive patients or lactate levels that were increased. The 6-hour bundle includes measuring central venous pressure and central venous oxygen and doing a remeasure of the lactate count if the initial lactate was increased. Let me try to stand just a little bit. Can't get to move down. I do agree with the suggested recommendations that the research shows, because this is what I have personally seen work for our patients in the emergency room. They do have better and safer outcomes. Get my thing to move down. Try to close it up. So, 1 second, I'm trying to get my things to start down. All right, so step 3 was understanding the process, and it asked like, did I have senior leadership and buy-in? And I did. We explained to our nurse managers as well as the nursing CEO what issues we were having and what methods we thought we could maybe help combat sepsis mortality and morbidity. And we do have a clear defined role for our patients. They are the customer. The sepsis process has been defined and outlined. I do have data showing the issues and showing what protocols we do plan to follow. We plan on forming a sepsis champion team who will be responsible for monitoring all septic patients in real time. The sepsis champion team will support the nurse with anything she may need for that patient, getting medications, doing lab draws, anything that the septic patient would need, and also make sure that documentation is accurate and done in real time. Um,
And
Let's
that's
see.
probably the most challenging.
Yeah,
The
like
documentation in real time. Do you take care of the patient or do you document it? I
Right.
mean, it's just
Take
yeah.
care of the patient.
You take care of the patient.
that's what you
exactly.
want to do.
That's what you
but
want to do.
They
But they
don't.
want you to document. But I'm gonna take care of my patient first.
Right.
So,
They
yeah.
want the documentation to
Yes.
show in real time.
Mm-hmm.
So I think the Sepsis Champion team is real good. Because I know first is just so busy, and sometimes you can have up to 2 or 3 ICU patients at one time,
Exactly.
and just
Exactly.
being hands on and doing real time documentation, it could be an issue.
It's very challenging.
So I think that having a Sepsis Champion team will kind of help
Yeah.
the nurses and help put everything back in place. And if it's something not done, we'll be able to go in and catch
Yeah.
that like right then.
Because lab can let you know what the labs are. If the
Mhm.
physician is around, he can go ahead and do the orders. And I mean, you can just go ahead and knock everything out right there.
Right.
Yeah.
Just like running a code.
There you
Yeah.
go.
Yeah, that's true.
If you have a good team, you got a good leader, you're good.
Yeah, that's good. Thank you. Let's see. Let's see. And with this process, they wanted us to eliminate blaming people like for the problem. They want to blame the process. So, like I said, we are wanting to form the sepsis champion team so that we can take the blame off of the nurse personally and just have a team that would help out and assist everywhere that help was needed with these patients to get them what they need in a timely manner. We will get support from our nursing team, our nurse educators, our nurse managers, and the CEOs and anyone else that'll be up that chain of command that would be responsible for helping make those make the decisions or make the agreements to form the champion team. Let me see. And then if for some reason sepsis protocols are not implemented within that 1 hour period or within the required time frame, then we will get someone from an upper level of management to come in and check on that patient in real time and enforce that those things be done or help wherever it's needed to get those things done for the patient.
And I think a lot of times it's not that it's not done in real time, it's that you're actually doing it.
You're doing it, but
You're
you don't
doing
have
it,
time
and
to
you don't have
document
time
it.
to document because you
Yeah.
have to get the medicine started. You have to draw the labs. You have to make sure the vital signs are stable. You have to make sure the patient is stable. So,
Right.
like, if you have to weigh it, you have to make sure the patient is stable.
Yeah, that's true.
That's the challenge.
That's true. That's a very good point. It's slow to load up. All right. And as I discussed earlier, I have identified ideas for various levels and types of team support, which would be the physicians, advanced practice nurses, advanced practice providers, medical assistants, respiratory. We'll have the cold sepsis, which will be the sepsis champion team or rapid response. Some people use those. And the sepsis protocols will be initiated if that patient is deemed to, in fact, be a septic patient. And management has agreed that this will be a successful process. Wait a minute.
Oh, yes, ma'am.
Open this up like another way.
So, do you guys, the team, do they have meetings, or how do you go about getting everybody on the same page, like the physicians? That's,
We do. We have huddles every morning,
yes.
and then while we're in huddle, we discuss like the percentage of how many patients were that were septic did receive care versus those that didn't receive care. We go over like the nursing protocols for the septic patient, where those follow and where they not, and then we try to come up with like ideas, or they'll ask what do we feel like we could do differently
And
to try to
also,
have like an increase in compliance.
yes. And with all the team members, so y'all have like the techs and everybody in on your huddles. Yeah.
Yeah, everybody is in on
Everybody's
it.
a part of it.
Yep, and the physicians too.
Yep. To have everybody on the same page, that helps everything.
Let's see. Okay, so I have to hit that one. And then the other slides, we talk about just the method for patients once they arrive to the emergency room. It just discusses from the time the patient hits the doors until their triage. If during the triage the nurse feels like the patient is septic, or if we had flags that fired that's saying that the patient may be septic, at that time we'll call a physician in or the advanced practice provider, and they'll overlook the patient, look at the vital signs, and see if the patient meets the septic criteria. And then if they do, at that time, we call a code sepsis. And from that time, we have 1 hour to initiate, do our blood cultures, do our lactate counts, CBCs, those other labs, and start antibiotic and fluid resuscitation for the patient. So again, the aim will be to form the sepsis champion team, add alerts to the electronic charting system that would alert nurses of outstanding sepsis tests that had not been performed, and educate the general public regarding what sepsis is within 30 days. That's the time frame we would like to see that done. And then our key outcome metrics would be to decrease mortality and morbidity rates related to sepsis. Overall, we want to decrease length of hospital stays to less than 3 days. Also, decrease readmission rates so that the patient won't be back into the hospital or admitted again within 30 days. Discharges to home versus a long-term care facility would be the hope. And also to reduce costs and waste and give adequate health education to all patients and their caregivers and family.
Code sepsis. That's a different one for me.
It is.
We don't have a code sepsis, so that's a good idea.
Yeah.
Yeah.
It is because it's really big. I remember being a nursing student, right? But I never knew what they meant by like what is sepsis, and I seen at one of the hospitals, probably name, but they had like I want to say it was like a 90% death rate
Oh my
wow.
gosh.
due to sepsis, and it was because I think like nobody was really educated on
They
it.
weren't
Yeah.
educated.
Like nobody knew what it really
Yes.
looked like. So
Just
like
the same as with strokes, heart attacks, all those things. Like, if people didn't know, they didn't
Mhm.
have the early recognition, I mean, it would be higher now.
right,
But you see a lot of people, a lot more people are living with those things because the community is educated.
yeah,
So, yeah.
that's true. You're able to act on it quicker. That's why they want to utilize that 1 hour process.
Yes.
That time frame for you to get everything started, and
Exactly.
you get the patient going up versus spiraling down.
Exactly.
So yeah, so that's real big. That's why we had like a bunch of septic
So
patients.
that's something you can talk to different people at different facilities, and like you can actually, because that's something that I could use. Like the code sepsis. Yeah.
Mm-hmm. Yep. And that could be any source of infection anywhere.
Exactly.
It could be
Exactly.
pneumonia, bronchitis. It could be a urinary tract infection. Any kind of infection. Yeah. So let's see what else. Okay, so some interview questions that like I can ask you guys, or I know like Christina, because she does emergency room. So what do you feel like has been preventing you from completing sepsis protocols on patients in the past?
Well, with me in triage, sometimes like how it rained up so many times for a whole bunch of people, like, and sometimes it's hard to decipher whether it's really sepsis or not. So you don't want to mess around and call cold sepsis on everyone because
Because it's viral.
Yeah,
yeah,
it's firing on
yeah.
everybody.
So then your nursing judgment kind of comes into play too.
Yeah.
Yeah.
Yeah, that's a good
But I
point.
know we're working with our type of patient and our patient population. Sometimes it's hard to, tell.
Mm-hmm.
Yeah.
Yeah.
Mm-hmm. Yeah,
But
so
do
that
you guys
was,
see a lot of the same patients? Like, do you
Yes.
see a lot? So if you do, then you're able to recognize,
Well, yeah.
differences in them.
Yeah.
So
Yeah.
that's the thing with that.
Yeah.
So
some people's heart rate might be like 120,
Yeah.
140.
I had some people, you see them
You know.
over and over again, so you know kind of what they're
Yeah.
coming for.
Yeah.
You already know, and then
Yeah.
you're like, wait a minute, this is different.
Yeah.
Something is off. So you're able to see that. So that's a help in itself.
Yeah.
Yeah, that's
Yeah.
true. That's a good point. That's a very good point. So, she was just saying, so they were just saying that sometimes like when the patient comes in and the BPA fires or the flag alert in the chart, it'll fire like for anything. It could be a temperature, it could be an increase in heart rate, anything can make the sepsis code fire. So you have to use your nursing judgment and make a decision like, okay, do I really feel this patient is septic or not? And then you would call your physicians in or your advanced practice providers in, and ultimately they would be the one to call the code sepsis.
And sometimes something that's keeping you from completing it is when you have to do all of that stuff separately, like by yourself,
Yeah.
because maybe the doctors aren't listening, or people aren't educated on sepsis fully. They are slower to react.
Mhm.
So you'll probably have to be starting fluids, drawing blood, starting IV,
All of
everything
Mm-hmm.
before you could even get to the computer to say what you've
Exactly.
done.
Right. Yeah. That's very big. That was real big, and that's why I think that the Code Sepsis Champion team, they could help with that because
Because
they
you
would
guys
be.
have a relationship with each other, and
Mhm.
everybody's on the same
Same
page. So
page,
you already
yeah.
know, they know if you're calling them about this,
Mhm.
that there is a concern. So we
Yes.
need to go ahead and act on it.
And it's
I mean,
their specialty.
And
Exactly.
that's all they would do is
Exactly.
septic patients, and,
Yes.
and that frees up the nurse to
To
focus
do
on
it.
other things,
Exactly.
and then make sure everything gets done with that patient. So it's real big.
think it's- yeah.
Real big. Real big. And then with this project, like we didn't have time to fully implement it. So we were going to give like an idea on like what my expectation was if we got the sepsis champion team implemented, which I do think that would be a big benefit. But the what I think would happen would be that mortality and morbidity rates for septic patients would decrease, and it would just be safer outcomes for the patient. We would save more lives with the sepsis champion team. So
Yeah.
hopefully that's something we can look for in the future. And my name is Sophia, and that completes my presentation. Thank y'all.